Hello, my friends. This is Deepak Chopra again, continuing our conversation with influencers and luminaries. And today I have two very wonderful people, Manu Jaggi and Anu Singh, joining me. And they are both scientists and have a background in both Western medicine, science, um, the laboratory aspect of understanding the healing system, including adaptogens and Ayurveda. In fact, I think it's Manu, were you at the All India Institute, right? So
No, that was Anu. I was at the National Institute of Immunology in Delhi.
correct. So Manu is from the National Institute of Immunology in Delhi, and Anu was at one time with the All India Institute of Medicine, where I went to medical school. And it's a great joy for me to be collaborating with them. They also helped me with creating about 10 Ayurvedic adaptogens for the healing company. And as you know, some of the assets of the Chopra global company were transferred to the healing company. So we're all working together. And at some point, I also want to mention that part of the assets of the Chopra Global were transferred to International Institute of Nutrition. And this is a company with about 140,000 or maybe 150,000 coaches. They are taking Chopra coaching training as well. So we will have an army of coaches, well over 150,000 certified by the Coaching Association, all of us working together to move in the direction of health, joy, mental well-being, and everything that's connected with that, a more peaceful, just, sustainable, healthier, and joyful world. So long introduction, but and you'll see the credentials and the work of Anu and Manu at the bottom of this podcast. And if you're more interested, you can always send your queries to deepakchopra.com. So sorry for the long introduction. I'd like to start with Anu, and Anu, a little bit of your background and then what you're doing with Althea, Dabur, etc. And then we'll move to Manu as well.
Yeah. Thank you very much, Dr. Chopra. I think you've already given a very nice introduction for myself. So I'm going to keep it very short. I'm trained in molecular endocrinology from a medical school in India. It's called the All India Institute of Medical Sciences. So I started my journey with translational biology, if I may say so. We were not using that term that many years back, but I was working on brain tumors where we were working between the clinics and the labs and trying to understand what goes wrong in some of those brain tumors to suddenly go into an aggressive phase. So I learned pharmaceutical drug discovery and development first from All India Institute of Medical Sciences. And then I did my postdoc at National Institute of Immunology for a couple of years. And then I joined Dabur. Now, Dabur is India's oldest and largest healthcare company with a clear focus on bringing natural remedies and creating natural remedies for people. We are an ancient company. We were set up in the 1884. So we like truly ancient. And the whole, what I learned at Dabur, I'll just take a minute here, coming from a medical school, what Dabur taught me was that pharmaceutical way of developing drugs is fine. It has its strengths and it has some limitations as well. And if we were to combine that systematically with the natural products, logical, systematic combinations, there is so much that can be achieved in restoring health and wellness. So I think that is what we've tried to do in the last few years, Dr. Chopra, that take a very science-based approach to developing natural products, utilizing the wisdom that we have in our country from so many years, but put the rigors of science behind it to create products that actually work first in the lab, then in clinical trials, and at human beings at large. I know you asked me for my introduction, but I know the loop has to actually work like this, that I talk about myself, but what I do today is sum total of what I've learned from pharmaceutical industry and from Dabur. So I'm going to stop here, and I think it's your.
Yes, please, thank you very much, Manu.
Right. Thank you, Dr. Chopra, for having us both here and having this conversation with us. It's a real honor and pleasure to be a part of this conversation. My name is Manu Jaggi. I'm a pharmaceutical scientist by training. So my early years of education were in the pharmaceutical sciences. And after having done my basic training in that field, I shifted a little bit into a different area. I got into cancer immunology, which is the subject where I did my doctorate and postdoctorate. And about 32 years ago, after doing my postdoc, I decided to join Dabur, which to a very large number of people, my contemporaries, even my mentors at that time, was a very unusual decision. What is somebody with a pharmaceutical training and having done work in cancer biology, doing in Dabur, because Dabur, as Anu explained, is a very traditional Ayurvedic company, very old traditional Ayurvedic company. But I think the intent was very clear. We were at that time looking at making a paradigm shift on how the Ayurvedic or natural products should be developed, moving from just copying what is written in the ancient text and mixing two ingredients and hoping that they will work, to doing something which is more rational, more translational, and more biology focused. So last 32 years have been spent, like Anu said, following the rigors of pharmaceutical development, but applying it to a totally different field. A lot of people say that Ayurveda is the complementary medicine. I tend to disagree. I think modern medicine is what is complementary. Ayurveda and any ancient system of medicine is the original system of medicine. So the last 3 decades have been spent trying to remove some of the skepticism around these systems of medicine by undertaking the research which the modern scientists understand and believe, so that the gap that has created over last few decades, that gap closes, and everybody speaks the same language. So that's essentially what I've been involved in over last some years.
Wonderful. So that's a great introduction from my two scientific colleagues, Anu Singh and Manu Jaggi. For those of you who are new to this conversation, I would like to summarize a little bit about my work with Ayurveda in the last 35 years or so. I was introduced to Ayurveda by Maharishi Mahesh Yogi, and then I met a lot of Ayurvedic doctors. At that time, I was focused on my expertise in internal medicine and neuroendocrinology, which is my specialty, board certified in internal medicine and endocrinology, and then neuroendocrinology and metabolism. And what I realized as I explored Ayurveda was that Ayurveda was actually a science that looked at experience rather than measurement. I think just now you heard Manu say that he wanted to bring scientific rigor to the already well-established science of Ayurveda, which is more qualitative than quantitative. I like to think of Ayurveda as qualia medicine, the quality of experience. But if you look at Ayurveda and its origins, which go back ancient times, it's really more than medicine. It's the science of life. Ayurveda is a division, a subset of a broader system, which comes from the Vedanta and has to do with consciousness. But the Vedic literature has a lot of subdivisions. Ayurveda, science of life; Sthapatya Veda, science of architecture; Gandharva Veda, science of music; Jyotish, science of astrology, etc., etc. And so Ayurveda is part of a very much bigger, broader system of knowledge that comes from a very fundamental precept, and that is consciousness is fundamental, and matter or biology is an experience in consciousness. In fact, what we call our biology is is a changing experience in consciousness. And even though we refer to our biology as physical, it's an interpretation of human perceptual activity. Notwithstanding that, Ayurveda has some very interesting aspects to understanding life and the science behind life. Ayurveda is based on a very simple aphorism, which is very ancient. Yatha pinde tatha brahmande. As is the atom, so is the universe. As is the microcosm, so is the macrocosm. As is the human body, the cosmic body; the human mind, the cosmic mind. And based on this, we have a deep understanding of, in Ayurveda, of physical body, of the energetic body, of the so-called subtle body, which is mind, intellect, and ego, and then the causal body, which is, of course, referred to as Jivatman and ultimately Brahman. So while the physicalist approach is bottom up, the Ayurvedic approach is top down. Start with pure consciousness, and then its modified expressions as Jiva, mind, intellect, ego, the physical pranic body, ultimately the physical material body. And as a result of this understanding, in Ayurveda, we have actually something called mind body types that we can assess through various procedures, including a good physical exam, a good history. You can actually understand a person's mind, body, personality, propensities, their likelihood or risks for certain kinds of diseases, and treatments that pertain to almost 9 different body types. The 3 basic body types are referred to as Vata, Pitta, Kapha, but simply means some people are essentially hypermetabolic in their mind body experience. Some people are more inflammatory or tend to be more inflammatory, and some people tend to be more retentive. So Vata gives you risk for degenerative disorders. Pitta gives you risks for inflammatory disorders. Kapha gives you risk for retentive disorders. And everything we understand in modern science with our diagnostic methods can actually be put in a bigger framework of mind body types, and there are approximately 9 body types. And then the interventions in Ayurveda include things like deep rest, sleep. They include things like mind-body coordination, which includes pranayam and yogic exercises and bandhas and kriyas and vagal stimulation and various rituals, but also a deep understanding of nutrition, mostly based on plant-based foods, a deep understanding of nutritional supplements or complements, or micronutrients or adaptogens based on Ayurvedic herbs and combination of Ayurvedic herbs. So nutrition is a very important part of it. There's daily and seasonal routines that actually change with both the time of the day and the season, so you can maintain your biological rhythms. And then there's a deeper understanding of the source of all experience, which is pure consciousness, a field of infinite possibilities, infinite correlation, unpredictability, creativity, evolution, and transformation. This is a kind of a very brief summary of the philosophy behind Ayurveda. But now, this conversation, I want to take it to the next step because both Doctors Jaggi and Dr. Singh are experts in biology, and they have led the research at Dabur and a new company called Althea in creating a scientific basis for some of the Ayurvedic herbal compounds. And as far as I can tell, these compounds are a little different from traditional pharmaceutical agents, which are usually created in order to interfere with the mechanism of disease. On the other hand, the Ayurvedic compounds don't really interfere with mechanisms of illness, say, as an antibiotic would or as a chemotherapeutic agent would, but they enhance self regulation, self healing, homeostasis, and many of the Ayurvedic compounds are actually considered to be adaptogens, which is they modulate the effects of stress at a cellular level in biological systems. And with that, I'd like to ask first Dr. Manu Jaggi to comment on what's the basic understanding of the Ayurvedic herbal preparations and other, what we might consider Ayurvedic medicines. What is the fundamental premise on which they are founded? And then we can go and do some examples, and I will ask Anu to comment as well after you have commented, Dr. Jaggi.
Thank you very much. Since I come from a pharmaceutical background, and first 15 odd years, we were working on developing purely pharmaceutical products, essentially in the field of oncology. So we had a very close view on how pharmaceutical products are developed and how they work. And during this time, we observed very closely as to what are the advantages and also some of the downsides of the pharmaceutical product. And like I said, since I also come from one of the largest, oldest Ayurvedic companies, it's very difficult even for a pharmaceutical scientist to stay away from Ayurveda because we were literally eating, sleeping, breathing Ayurveda all day long, even though we were in the early years not so much involved in it. But very hard to keep that away. And seeing the upsides of Ayurveda, sooner than later, I knew that I would get absorbed into that system of medicine. Now, with the pharmaceutical background and with the understanding of Ayurveda, we tried to pick up some good practices of the pharmaceutical medicine. But one of the things that Dr. Chopra, you very rightly mentioned, is that pharmaceutical products are really based on interference. They essentially work on interfering with a mechanism. And there was this concept started about 20 years ago, where most of the pharmaceutical products were being developed addressing or attacking a single target of a disease, of a pathophysiology. And everybody believed at that time that if you work or cut off a single target, you'll be able to take care of a particular disease. As time would tell, disease is very clever. Disease always finds an alternate path to come back and attack you. So, since we were in the field of cancer, we believe that, if you are able to stop the proliferation of cells, or if you are able to block the cell cycle, maybe you would be able to kill the cancer cells. The US declared a war on cancer almost 50 years ago. And everybody believed at that time, the president said that in 5 years, we will have a cure for cancer. That was way back in 1960s, 1970s. We are still trying to find a cure. That's because the disease is often underestimated, but the body always finds a way to come back and attack the immune system and make our body more inflamed, leading to a disease. Ayurveda works on a very different principle, a completely different principle, where you are not looking at a mechanism, where you are not looking at a particular pathway. Dr. Chopra, you use the term adaptogen or a modulator. This is exactly what Ayurveda does. As we all know, it is more about restoration. It is more about bringing the balance back. You often talk about the 4 or 5 pillars of overall wellness. We talk about restoration of immunity. We talk about restoration of reduction of the inflammation. We talk about the restoration of the cognitive health, and we talk about the gut health. Let's say largely these 4 things. And Ayurveda essentially maintains a balance of all of these 4 seemingly distinct yet completely related functions. You have an upset GI system, it affects your cognitive health, or vice versa. Your body is inflamed, your immunity goes down. There have been experiments to show that people who are bereaved, who lose their spouses, their immunity level goes down. So I think the way Ayurveda addresses this whole disease thing is by restoration, is by the adaptogens that we have, a very strong tool in Ayurveda. We put that to good use and we are able to restore the functions. So that's my learning of last few years. Would let Anu talk about some specific examples on how we may have used these principles in actually developing something, which is which goes beyond what the pharmaceutical medicine has been able to do.
So thank you very much, Dr. Jaggi. As you know, with your help and with Anu's help, we have identified approximately 8 to 10 Ayurvedic preparations that we will be all supporting through the Healing Company. And maybe Anu, you can comment on some of those compounds that we are creating or created and why they actually are a great of a great advantage over some of the pharmaceutical approaches we use. Maybe we can talk specifically about a few of the preparations that the Healing Company will be promoting with your and my help and scientific validation. So let's talk a little bit about those preparations.
Thank you, Dr. Chopra. The products that you just mentioned that we are working together and we've done a lot of work together already and we'll continue to do for the Healing Company. I think they are a very fine example of how we have brought together the goodness of herbs and the pharmaceutical science behind it, backing it, to create a novel class, if I may say, of adaptogens, which address a lot of lifestyle conditions that affect us, but the key conditions which actually take the balance out of our body. We've created products around that. The whole, Dr. Chopra, if I may say a minute, before we go specifically into the product, what you said about Ayurveda being classifying people into different categories depending upon their propensities, I like to think of it as exactly what we are speaking about, personalized medicine. According to me, Ayurveda is the oldest form of personalized medicine, not what we speak today. I mean, in the pharmaceutical world, we talk about personalized medicine. We say we are creating so many monoclonal antibodies that work on X target or Y target. Yeah, sure, they work a lot. But the whole issue is that each one of us is unique, and Ayurveda recognizes that. There isn't another person like us. We are unique in every which way. Therefore, the therapies, the restoration of balance, the adaptogens, the class of products that we are talking about, has to address our unique issues to restore balance. Now, if we were to talk specifically about these products that we have created, we recognize the fact that when a body is out of balance, there are places which are now clearly out of balance. It could be related to the mind, it could be related to the gut, it could be related to immunity, which is either an overactivated immune system or an underplaying immune system. Or there could be excess of oxidative stress in the body, which is in turn leading to a lot of inflammation, which in turn is leading to a lot of disease conditions. So I think the whole, if I may say, the whole guiding principle behind this class of products that we have made is that if we were able to address this by the right combination of herbs. So if we are talking, if I may take one example of the products that we've made, let's say it is related to the gut health. If we were taking a product that addresses gut health, the option that we have for gut health in the pharmaceutical sciences is a class of antibiotics to take, or a combination of antibiotics to take away the bacteria that may be in the gut. What we have tried to do here is that we have to restore the balance in the gut. In other words, we need to reduce the inflammation in the gut such that the gut is healthy. It's no longer a leaky gut, and it allows healthy bacteria to actually build up in the gut. So how does one do that? So we have identified several herbs which are known to work on each of these pathways, herbs, and we bring them together in a synergistic fashion. That is the most important thing here. When we are talking about adaptogens, it's the choice of the herbs. It is actually putting the right herbs together and making combinations that work on all the pathways that have gone wrong in the gut. I think this has been the soul of the products that we have actually worked with. And then the next step is to actually be able to measure the effects that we are seeing. So this is not a concept alone. It starts with a concept, but ultimately one measures it in systems in the laboratory to see whether it's doing what we are thinking that these herbs should do together. So I think this is the kind of work that we have been doing. And if I may add one more thing, we pay a lot of emphasis to the safety of these combinations. We have done that in this class of products. These are products that one wants to or needs to take for a longish period of time. You are restoring balance in the body. It can't happen overnight. It can't happen with 5 days of taking that medicine and then stopping. So if I want the body to return to its balance, whether it's in my gut or it's in the brain or it's the immunity, the safety of the herbs and the safety of the combinations and the safety of the finished product is something that we pay a lot of importance to. And we put a lot of rigor around that so that people can comfortably take products which have known efficacy and safety. I think maybe would you like to add something more?
No, just Dr. Chopra, if I may just add one point, since I have a pharmacy background, we've spoken a lot about the good things of the medicinal herbs. There is also one shortcoming. The shortcoming is that the active ingredients of the medicinal herbs, they are very often insoluble in nature and therefore have a poor bioavailability. Now, what that leads to is that, one could keep popping in pills all the time containing certain purified herbal extracts, but their absorption is very poor. And you take in something and it just gets excreted out, doesn't get into your blood system, doesn't get to the place where it is supposed to demonstrate its efficacy. And that is one of the reasons that there could be hundreds of products on the shelf, let's say for treating diabetes, but why is it that some work and others don't work? There could be many different reasons. One of the reasons is that some of those products do not address the bioavailability of these herbal products, which is very important. Now, there are a couple of different ways to do that. The best way, in my opinion, to do that is to again use a natural product which enhances the bioavailability. In India, there is a spice called the kali mirch or the black pepper that everybody uses in the cooking. Now, besides the fact that it's a nice flavored spice with a great aroma, it's also a very strong bioavailability enhancer. You add a little piper into your Ayurvedic products, you enhance the bioavailability. The other example is, and to give credit to the pharmaceutical science where it is due, there's been a lot of talk of nanotechnology in recent times, or nanotization. So what we also do is we nanotize our herbal extracts. We bring it to a size which is so small that it is able to pass through the gut into the bloodstream, and therefore increasing the bioavailability from something like, let's say, about 8% or 9% to even 30%, 40%. Now, if you're taking, let's say, a 500 milligram dose of something which is not bioavailable, it'll only do little. But if you add, let's say, a natural bioavailability enhancer, or if you nanotize the herbal extract, now you suddenly enhance the efficacy. So that's another thing that we pay a lot of attention to make sure that what we develop in the lab actually benefits the person who's taking it to address a disease condition.
May I just add an example to this, Dr. Chopra? Now, I think there is such a nice connection between the truth in the traditional knowledge and how these herbal products is what we are developing here. If we just take the example of curcumin. Now, traditionally, haldi or curcumin was always used as per Ayurveda logic. It was used to, it was added to milk and taken. It was a tradition to always take it with milk, particularly if somebody had a fall or injury and you wanted it to heal quickly. Now, if one thinks about curcumin or haldi as a molecule today, it just does not dissolve in water at all. The only way it is going to work is if we make a fat-soluble formulation out of it. So there was a logic to that knowledge, but today, in our approach, when we work with anything related to curcumin, our formulations are always fatty acid based, because that is how the bioavailability actually comes across. Otherwise, it just goes in and gets out of the body. So, yeah, just wanted to add that.
Beautiful summary. Thank you both. Let's talk about a few. Let's talk about a few of the preparations that we're looking at with the Healing Company, and what their promise is. We don't have to cover all of them, just 2 or 3 of them. For example, something like a modified Chyawanprash, which has been there for thousands of years. What does it do? How does it work? Either of you.
Yeah.
Right. You want to take that? All right. So,
yeah.
Chyawanprash is one of the oldest Ayurvedic formulations that we've all known. It's been written in the text like hundreds of years ago
by Chavan Rishi.
Yes. Yeah. And contains like some 50 odd herbs made in a certain manner, and only if it is made in a certain manner does it work, and doesn't work if it is prepared any differently. So we've all been using Chyawanprash, and we tend to just believe that this is beneficial for us. But what does it exactly do? It does various things, and Anu and I set upon trying to understand the biology of how Chyawanprash works at cellular level. And one of the first things that we looked at was how does it impact or restore our immunity. So we, without getting into details, we looked at what does Chyawanprash do, let's say, to our natural killer cells, one of the first defense mechanisms of the body. What does it do? So we saw that Chyawanprash actually elevates the function of the natural killer cells by about 2 to 3 fold. We all know that, especially in India, when the winter sets in, all parents tell their kids, you should start taking Chyawanprash because otherwise you'll fall ill. There will be some viral infection, flu, and last 3 or 4 years, ever since the pandemic started, a lot of emphasis was put on viral infections and how we can prevent some of those infections from happening. Now, hopefully, the pandemic is in the past, but there is a huge spurt of respiratory infections. So we do know that Chyawanprash also is beneficial in preventing some of those respiratory infections. So we have looked at, what does it do to our IgE levels? What does it do to
and to phagocytosis, to a lot
the
of
mast cells, the
mast cells.
phagocytosis?
So so I think yeah.
Please.
So I like to think of Chyawanprash as the oldest actually anti-aging or good health restoring product. It hasn't been evaluated to the extent that it should be. It is, but this part, this data that you were just speaking about, the fact that it actually enhances immunity, it's very good with phagocytosis, it works great on NK cells. That is something, it was very challenging to do this work. Antioxidant activity. It was very challenging to do this because Chyawanprash is a very complex polyherbal mix. But we asked ourselves that if the product works so well, if it actually, we're not talking about a small clinical trial, it's large populations. It's actually a very large clinical trial, large populations of people taking it and saying that we fall sick less. That's what they say. It shows up so nicely in a quantitative manner in the NK cell activity. And I think what really made us feel very good and humble at the same time, that we were able to quantitate how much of NK cells, what does it do actually to them? We were able to get numbers around it. And I feel there is a lot more to do, but it's a very rational mix of about 50 to 70 herbs mixed in a certain manner, which was designed to be anti-aging through all these mechanisms that we perhaps just spoke about, and many more that we don't know right now.
So this is a very good summary of just one of the compounds, the Chyawanprash, which is of course very well known. At the Chopra Foundation, we are actually promoting something called the Longevity Experiment, which is based on understanding the physical body as a field of awareness, understanding the metabolism of time, using vagal stimulation, adaptogens. But I think Chyawanprash has to be, or a modified form of it, has to be a very important part of our longevity programs and our longevity studies. And I'm just asking everyone who's listening to this to stay tuned, because we'll be periodically giving you education on these very unique compounds, whether they are for sleep, for stress management, for longevity, for women's health, for men's health, and anti-inflammatory, and much more. So that's a very good summary right now to give a broad overview of how these adaptogens and self-regulation molecules work. In the last few minutes, because we have a time limit here on social media, I would like to address something that actually came up a while ago, and that was, I see a lot of patients who are struggling with cancer, chemotherapy, and we are trying our best to minimize side effects, and many of these Ayurvedic interventions do that. We don't have time to discuss that, but one thing did come up, and that is hair loss with chemotherapy is a problem, along with, of course, nausea, vomiting, etc. And we were having a conversation a while ago, and you were sharing with me a little bit of the research that you have been doing on mitigating both side effects, but particularly looking at hair loss because it's a global issue. Maybe we can end with a little short comment from each of you on this work and the future and the promise. And if our audience really shows enthusiasm for this, then I think this is something we should embark on together.
Sure. Dr. Chopra, this subject is actually very, very close to my heart. About 30 years ago, as a very young scientist, about 25 years old, when I started working in the field of cancer, developing anti-cancer molecules, small molecules, essentially chemotherapeutic drugs, and taking them all the way into clinical development, I was exposed to the toxicities associated with chemotherapy when I used to visit the hospitals overtaking some of the drugs that we had developed. And I noticed how traumatizing it is for the cancer patients to undergo some of the severe toxic effects. And essentially, these toxicities are all attributed to one single thing, which is that chemotherapy essentially works on the principle of attacking the rapidly proliferating cells. So we all know that tumor cells, they proliferate very fast. Their doubling time is reduced from, let's say, a normal 6 to 7 day or even longer to sometimes as little as 24 hours. So therefore, the approach that the modern pharmaceutical medicine followed was that they said, what if we kill all the rapidly proliferating cells? Now, while that killed the cancer cells, that also killed the other rapidly proliferating cells, one of which were the dermal papilla cells of our hair. The other was the rapidly proliferating immune cells. So all the toxicities that are associated with chemotherapy are because of this one fundamental attacking rapidly proliferating cells: neutropenia, peripheral neuropathy, chemotherapy-induced alopecia, nausea, vomiting, all because of that. And we thought that while we are working on developing cancer medicines, why should we also not look at finding herbal-based mechanisms, herbal-based interventions to alleviate some of these toxicities? And we picked up chemotherapy-induced alopecia. Now, even before we embarked on this journey, we spent about 1 year trying to understand the hair biology. What exactly happens? Why do we have hair loss? Why do hair cells suddenly stop proliferating? Why do they go from the anagen, which is the proliferative phase, to the telogen, which is the resting phase? And it turned out there are about 6 or 7 different pathways that go wrong, which lead to hair fall. So the hair follicles are all there, but they go into a dormant stage. They stop proliferating. So once we understood this biology, we started looking at the herbs that are already available in the ancient textbooks. Eclipta alba is one of them. Bringraj is another one. And there were several more.
Caffeine, some of the essential oils. I think the most interesting were some of the essential oil derived from herbs, a couple of herbs. There are well-known herbs like thuja. There are herbs like caffeine. There are which is
onion extract.
Onion extract, Eclipta alba. Now, these are things that have been used in isolation by different people at different times. But what we reasoned with ourselves was that if we were able to understand the 9 pathways, we identified 9 pathways which actually come together to lead to hair fall. Now, this hair fall is different in chemotherapy-induced hair fall versus, let's say, a gradual thinning of hair in men and women as we age. Now, we tried to understand these pathways and did like a matching. Okay, what are the herbs that actually work on these 9 pathways to restore hair growth? And how would it restore? It basically takes these resting follicles, which are alive, which are there, but they are just gone into a quiescent state because of chemotherapy or because of hormonal changes. It pushes them to start proliferating again and sprouting hair. Now, we wanted to create a system, if I may say, a system or a formulation of these herbs which were gentle, but when put together, they made a very potent combination such that a person can use it again over a long period of time as a practice. It's something that should be used as a practice without worrying about the toxicities, let us say, that are associated with some of the popular products that are out there. Some of them cause skin irritation. There are others that cause much serious reproductive effects. So that was our logic behind hair biology. And we set up actually a separate unit of hair biology to first know the biology and then use that to formulate such herbal products.
Well, that's a very good summary. Thanks to both of you. And we have covered a lot of ground today, but this is a mere introduction. I would like our audience to stay tuned to future enlightenment on these products. including the creation and development of a product for hair loss. In the meanwhile, I do think this has been so inspiring that everybody who's been watching this could benefit from something as straightforward as Chyawanprash. And we will be talking about the other adaptogens in the near future. And please look up all the links at the bottom of this video, including our link to Healing Company, to Dabur, to the credentials of doctors Manu Jaggi and Anu Singh as well. I would like to thank both of you and say that we're very grateful for this new venture we've started together with the Healing Company. But there's more to come, because we, as I said, are going to have over 150,000 certified coaches who will be educating the public on these compounds, something that is lacking currently in the medical field. I think the most important thing we can do for our patients is educate them about the future of well-being, which is, as you said, Anu, very personalized. It's predictable. It's preventive. It needs our participation. It's a process. It's not something dramatic overnight. And there's a science, and the science includes not only what we call preventive medicine, but curative medicine, but also it's part of a larger aspect of how to live a fulfilling, joyful, healthy, and long life. So with that, I'd like to say goodbye to our audience right now, and more to come. Thank you both.
Thank you very much, sir. Thank you. It's been a privilege.
Thank you.
Thank you so much.